Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine Podcast. I'm your host, Yaron Ivan, as usual, and today, more important tips for you, the provider. Rule number 123. Remember, D10 is the advent of metabolic disease. So, this rule is trying to be humorous, I admit it, but it really is true. D10 is the advent of metabolic disease. So, if you remember our discussion about metabolic disease from previous episode as one of the presentations of a sick newborn, metabolic disease almost always comes with a component of hypoglycemia. And essentially, hypoglycemia is one of the most likely bad outcome of metabolic diseases. For the most part, for the metabolic process, there's nothing you can do to fix it. Many of those metabolic diseases of ill-appearing newborns come with hypoglycemia or cause hypoglycemia, which is something you can fix. And there's no better way to fix it than with D10. Just like we give Ativan for so many psychiatric and toxic conditions, intoxication of this, intoxication of that, overdose of this, overdose of that, D10 is almost always your go-to for metabolic emergencies. Must start with a D10 bolus. If you remember the rule of 50 to 100, the rule of 50 to 100 basically said that if you have D10 in your hand, the amount of D10 you will have to give to the child is the cc per kilo times the 10, and if it equals 50 to 100, you're good to go. So 5 cc per kilo, 5 times 10 is 50, that's great. You can do 10 cc per kilo, 10 times 10 is 100, that's great, or anywhere in between. Remember, the D10 bolus you gave will resolve the hypoglycemia. Again, look at the rule of 50 to 100. Once the hypoglycemia is resolved, putting the child on maintenance IV fluids with D10 will be your next go-to. I usually do that with 1.5 maintenance with the understanding that maintenance IV fluids are just going to keep the child at bay. But you want to make sure you stop the catabolic process, whatever it may be for that metabolic disease. So usually 1.5 maintenance with D10 will do the trick. So remember the rule of 50 to 100 to resolve acute hypoglycemia with D10 bolus, following by maintenance or 1.5 maintenance of IV fluids with D10. Surely there can be other problems with the metabolic disease. The patient may have high ammonia, etc. But usually those are not something you can actually take care of in the pediatric emergency department. Usually you resuscitate with fluids, resolve the hypoglycemia, and take it from there. So remember Rule 123. D10 is the advent of metabolic disease. Rule number 124. You will never diagnose something you didn't think about. I'd like to give Peter Dwan the credit for this wonderful rule. I think it's very clever and very wise, and it's very true. You're never going to diagnose something you didn't think of. Now, us emergency physicians, again, and I've said it before, we're not really in the business of diagnosing anything. We're in the business of ruling out bad, surgical, serious, or life-threatening conditions and treating them first. But we always have to keep our differential wide, but essentially, you'll never diagnose something you didn't think of. It's a good idea to include in your differential diagnosis, and that's one of the things I teach the residents, the worst case scenario and the most likely scenario. So the classic example in bronchiolitis season, we see a lot of pediatric patients, a lot of newborns that are wheezing. And wheezing is almost always bronchiolitis, especially in the winter. But every once in a while, that child in front of you that is having tachypnea, abdominal contractions, and maybe even wheezing can actually be the first presentation of his or her congenital heart disease. So it's always a good idea to keep an open differential, think of the most likely scenario, bronchiolitis, and the worst case scenario, no matter how rare it may be, congenital heart disease. Another good example is HSV in the newborn. We are trained to worry about SBI, serious bacterial illness. Get bacterial cultures, give Ampangent or Amponcefotaxime, whatever it is, but we're never really trained to worry about HSV. Now granted, HSV is very rare. However, if you don't think about it, you're never going to diagnose it, you're never going to give that dose of acyclovir, and your patient may have a bad outcome. So thank you, Peter Dwan, for this rule. And remember Rule 124. You will never diagnose something you didn't think about. Think about the worst case scenario, and even as rare as it may be, keep it in the back of your differential diagnosis. Rule 125. Always debrief with your team. Always. So this is something I try to keep in mind and I try to apply every day for my professional life as an attending. And this is something I definitely want to do after a resuscitation, but also after some unusual event such as an extremely busy shift, for example. So as I've said before, pediatric emergency medicine, as we all know, doesn't usually involve pediatric emergencies most of the time. So most of our patients are really okay. Most of the time I just provide some parental reassurance, but every once in a while we found ourselves resuscitating, doing CPR, intubating a patient. That is a fairly unusual situation and that requires debriefing with your team. So after we take care of the patient goes to the ICU, perhaps even at the end of the shift, I always find the time to debrief with my nurses, my respiratory therapists, and whoever was involved in the resuscitation. I usually start the session by asking people how do they think it went and what do they have to say. I try to be the listener before I am the person who's actually talking. I give people the opportunity to think about what we did and how can we do better and what other suggestions do they have. Then I give my opinion and we kind of review the case and see how we can make things better next time. I think that gives people the opportunity to learn. It also gives them the respect to understand that they are part of the team just as I am and just as everybody else is. And it's a really team effort. And in order to do better next time, we all sit together and discuss it as a team. I think the team often appreciates it and it leads to better learning and better results next time. Now, I try to find the time to debrief after some other unusual events. For example, if we had a very difficult parent and a very difficult patient, it's often challenging. There are several ways to go about it. Sometimes there are some very unhappy parents who leave the ER or some unhappy consultant. I try to find the time to debrief with my team about any such event. Again, what can we have done better to have a better outcome next time and how do we learn from the case? So always find the time to debrief with your team, not only for intensive care, CPR, and resuscitations, but for any unusual event that you think you can do better next time as a team. And that is it for today, guys. Thank you very much for listening and thank you for checking out the website. Let's review what we learned. Rule number 123. Remember, D10 is the Ativan of metabolic disease. Just like we use Ativan for many psychiatric conditions, ingestions, etc., D10 is your go-to for metabolic disease. Again, with metabolic disease, most commonly the true acute emergency is hypoglycemia. You can use D10 for your bolus to resolve the hypoglycemia and D10 for your maintenance IV fluids to keep the child at bay. Rule number 124. You will never diagnose something you didn't think about. Expand your differential, think about the worst case scenario, as rare as it may be, and obviously the most common scenario and what would you do about it. Rule number 125, always debrief with your team. Find the time to give the opportunity for people to say what they think went well, what they think went wrong, and how can you all as a team do better next time. And that is it for today, guys. Thank you very much for listening. Please check out PEM Rules and continue to submit any feedback or any requests for future episodes. I love hearing from you. The following is one of my favorite Nirvana songs from their first album, Bleach. It's called School. It's amazing how Kurt Cobain can write such a great song from just 2 notes.